Good afternoon. Thank you for joining us today on our third of our summer webinar series. Today's discussion will be on how new program integrity expectations affect Medicaid payments. This is the third in a series, if you go to the next slide, a series of webinars on changes to Medicaid, and coverage disruption. The first one was on state-directed payments. The second one was on community engagement requirements and 1115 guidance. And today's conversation will be on program integrity. So all three webinars will be available for replay on our healthmanagement.com/insights page, and that QR code will take you there. So there certainly feel free to share if you found something useful today. The purpose of this conversation, if we go to the next slide, these conversations is really to help everybody understand and make sense of the magnitude of changes that have been coming down from Washington to states and to stakeholders that engage in Medicaid, most of which driven by the OBBBA and different federal guidance coming down. So these are all big drivers of change to how programs work, change to how beneficiaries get access to care. And so we know that these are causing a lot of disruption and a lot of kind of strategic change in organizations across the system. And so our goal here is to provide some insight and to hopefully give a little bit of clarity on some things that have a big impact in your world. So let me introduce our fantastic panel today. I'm going to just go ahead and tell you a little bit about them, and all of their bios are available on our website as well. So Jennifer Bridgeforth is an associate principal at HMA with more than 17 years of healthcare experience and particular deep experience in health plan operations, compliance, payment integrity, and complex Medicare and Medicaid programs. Elizabeth Linville is an executive account manager with Health Tech Solutions, which is an HMA company, and she brings deep expertise in public sector procurement, guiding complex Medicaid and technology initiatives from strategy and scope development through vendor solicitation and contracting. Christine Ryan is a managing director at HMA, and she specializes in turning large-scale healthcare initiatives into actionable strategies, drawing on her more than 30 years of leadership across health plan operations, business transformation, and program development. Amber Swartzell is a senior consultant at HMA, and she combines her legal background with a hands-on health policy and compliance experience, helping organizations navigate complex regulatory requirements and helping advance Medicaid program and policy initiatives. And then finally, Patrick Teig is a senior vice president at HMA, and he's led major statewide health policy efforts, bringing his firsthand experience in Medicaid, commercial insurance regulation, and payment reform to expand access, improve affordability, and strengthen healthcare delivery. Undersold his experience a little bit as a former state healthcare leader. So I welcome all of you to the discussion today, and I will first kick it over to Christine to get us started.
Great. Thank you, Jen. So as Jen mentioned in the lead-in, program integrity is really entering a different kind of moment. Historically, these activities have been seen primarily in terms of compliance audits, investigations, recovering payments, after an issue has already occurred. And while all of those activities are still very essential and foundational in what we're doing, from a program integrity perspective, they're no longer the whole story. What we're seeing now, and what Jen had alluded to originally, is that there's a much broader expectation. So federal agencies are looking more closely at how organizations are overseeing providers, how they're managing payment accuracy, using data to document decisions, and generally demonstrate accountability across the enterprise. So this is not just a compliance conversation, it's really more of a governance and operating model conversation. So on the slide, you can see there are three primary shifts that we're seeing and things to keep in mind. So the first is really the move from compliance to enterprise accountability. Program integrity can really no longer sit neatly in one department. It really touches finance, operations, compliance, provider management, analytics, clinical teams, and general leadership decision-making. Organizations that are best positioned to navigate the new waters are the ones that understand how those functions will interconnect. The second shift really is retrospective reviews are becoming more important to be real-time risk management. So having activity that happens after a claim was paid after an audit began or after a pattern had already been developed is no longer enough. So increasingly, the expectation is to identify vulnerabilities early and use the data to see around corners before issues become findings, recoveries, or operational disruptions. And the last shift really is program protection to enterprise performance. Strong program integrity does not protect payment is more than doing just the protection of payments. It supports better oversight, stronger operations, greater regulatory confidence, and more effective stewardship of resources, and ultimately the support of member care. So strategically, the question is no longer, do we have a program integrity function? Most organizations already do. The better question really is your program or is our program integrity capability designed to manage and measure in a way that can withstand increasing scrutiny that we'll talk about more in this presentation today, while also supporting financial and operational performance? That is a frame that we're going to use throughout the conversation. So as we move through, I'd encourage you to think about your own organizations, not just what you're doing, what functions exist, but whether they're connected in a way that helps you anticipate risk, respond with confidence, and demonstrate accountability when scrutiny increases. So let's move to the next slide and we'll talk more about the importance of connected capabilities. So we've framed the strategic shift. The next question is what this looks like in practice. Most organizations have all of the right pieces. There's compliance programs, departments, SIUs, payment integrity, provider oversight, analytics, audit response, and reporting functions. But the real question is whether those pieces are connected. No longer can program integrity afford to stay in one lane. A provider issue can quickly become a payment issue, a data gap can become an audit issue, and documentation weaknesses can become a compliance issue. This is why the capabilities and their connections are so important. The goal is to identify risk early, act consistently, and demonstrate accountability when the scrutiny and audit risk increases. With that lens in mind, let's move to the next slide and we'll talk about what's happening federally and what is making this become more urgent. CMS and other federal stakeholders are placing greater emphasis on provider and vendor oversight, payment accuracy, data-driven detection, recovery, and accountability. That means organizations will increasingly be expected to show not just the program integrity activities exist, but that those activities are coordinated, evidence-based, and capable of producing timely action. This raises the stakes for states, plans, and providers. Organizations that wait for final guidance, an audit, or an investigation to expose gaps may find themselves in a reactive position. Organizations that assess their capabilities now, strengthen their governance, connect their data, and align operations will be better prepared to weather the federal expectations and where they are headed. The next question is where the scrutiny is likely to show up in practice and how organizations can align their FWA or fraud, waste, and abuse oversight to CMS and OIG priorities. At this point, I'll turn it over to my colleague, Jen Bridgeforth, who will say more on this. Over to you, Jen.
Awesome. Thank you so much. So, as we've been working with healthcare organizations, one thing that we found and really directed them about is just um, making sure your reviews align with CMS and OIG priorities because when you have someone taking a peek under your audits, you want to ensure that what you are auditing is actually something that is a high priority, but also something that might cause significant risk to your organization. So what we did, we actually have separated some of these high priority areas. So NEMT, non-emergency medical transportation, is really being reviewed by a lot of jurisdictions just based upon the level of FWA that's often found associated with these services. And then ABA is actually on the radar for a lot of states. There's been a shift over the years as far as ownership of those providing ABA therapy services. So they are starting to be reviewed quite heavily as well. Well, we can move to the next slide. And so just there's that connection of program integrity and compliance and truly having a strong compliance program where you leverage, the OIG 7 elements is so important. It allows for, self-auditing and really making compliance everyone's priority within an organization. So just new complexities that exist now from a federal standpoint. So you have cross-program compliance, and then you have advanced analytics and AI that are now assisting with detection and prevention. And then just real-time monitoring and reporting that now allows, payers to potentially put you on, pre-audit reviews. And that's really something that you want to avoid. So, doing all of the right things on the provider for a provider is ensuring that you are aware of, what regulatory agencies are targeting and what's important to them. And always having that mindset of, compliance really touches everything that you do in healthcare. We can move to the next slide. And then just focusing a little bit on payment integrity and, the steps that, kind of go from beginning to end. So you could really map this as mitigation to remediation. So mitigation is, all of those things related to, preventing extra costs. Some would argue that, mitigation is probably the most cost effective aspect of payment integrity because you're really preventing the pay and chase aspect of it. And I know that if you've been working in FWA for any amount of time, you've heard that phrase, pay and chase. And that's truly what, you want to avoid. And then that monitoring aspect, using data analytics and patterns and analyzing data real time, super effective in making changes to identify any type of patterns that you're seeing. And then remediation, that's recovering overpayments. And then completing provider education and not necessarily always, landing on, investigations and things like that, but moving more toward, okay, how can we educate providers, and remediate throughout? And truly, I believe in, there are times when investigations are necessary, but trying to find other ways to provide corrective action, I think is important as well. All right, we can move to the next slide. And just finding ways that so the mitigation to remediation. So different steps, if you think about mitigation and monitoring and remediation, what does that look like for your organization? For some organizations, it could be, hey, we start with, pre-service reviews, and then we end with, post-payment recovery, and not just, yes, it's post-payment recovery, but also adding in feedback mechanisms, for all those things that you do and you finding way to communicate those, whether it's to providers or what have you, communicating that in a way so that when you're going through the remediation process, that there's an actual change in behavior. All right, we can move on to the next slide. And Amber, I'll turn it over to you.
Thank you so much, Jen. Appreciate it. And so Christine and Jen have walked us through where CMS and OIG are focusing their attention and why expectations around fraud, waste, and abuse, compliance, and oversight continue to grow. So as you think about your own organization, the practical question then becomes, how do you respond in a way that's focused, realistic, and connected to the risks and the responsibilities that you're managing every day? And so one way to answer that question is to look at this through a readiness perspective across 5 connected areas that we see on this slide. The first is risk identification and stratification. That means focusing resources on the providers, claims patterns, and service areas that present the greatest risk or vulnerability for your organization. Most organizations have more potential issues than they have staff or resources to address them at any one given time. So prioritization of the issues is definitely critical. The second area is compliance and governance. This is about whether your organization has clear policies, oversight structures, accountability, and decision-making processes so that issues don't stall between departments. Um, as Christine mentioned earlier in the presentation, program integrity touches almost every organizational area. That includes operations, finance, compliance, provider management, and analytics. So each area needs a shared understanding of who owns the next step and when an issue should be escalated. The third area is data and systems integration. And for many organizations, this means looking at whether claims, encounter, clinical, and operational information can be connected in a way that supports oversight and decision making. And here we want to emphasize that the goal is not more data just for data's sake. It's having the right data available and usable when decisions need to be made. Fourth is fraud, waste, and abuse detection and investigation. This includes analytics, but it also includes the intake, prioritization, investigative workflows, documentation, and case management processes needed to support timely, consistent, and defensible actions. A strong decision tool really has limited value if your organization does not have an effective way to act upon what it finds. And finally, the fifth area is monitoring and reporting. This is where your organization needs to understand whether the program integrity efforts that you're utilizing are producing meaningful operational, compliance, and financial results, where new risks are emerging, and where implementation may be falling behind. So these 5 areas are where opportunities often begin to surface. And sometimes we see that an organization's need is concentrated in one area, such as governance or maybe payment integrity, but more often it cuts across several areas because all of these capabilities depend upon one another. And then identifying these opportunities is only the first step in the process. The harder work is then deciding what should happen first, turning recommendations into practical actions, and measuring progress over time. And so that's where the life cycle on the next slide is helpful, if we can go ahead and move to that. This life cycle gives us a way to connect the readiness areas we discussed with the actual work in strengthening them, moving from assessment and planning into implementation and ongoing monitoring. As you'll see on the slide, the life cycle begins with assessment. An organization first needs an objective view of its current state, whether the focus is governance, operations, analytics, payment integrity, or the program as a whole. A useful assessment should do more than identify gaps. It should help distinguish immediate areas of exposure from longer-term opportunities and give leadership a clearer basis for prioritization. Recently, for a client, that starting point for HMA was an organizational assessment gap analysis. This assessment helped identify where the most significant opportunities existed and created a common understanding of the current state before the organization could begin deciding what needed to change and what to prioritize. Once that assessment was complete, the next question was what to do with the findings, and that's where planning comes in. Depending on your organization, planning may include program integrity strategy, governance and policy development, operating model design, or a phased roadmap that separates immediate priorities from your longer-term goals. This is often where choices have to be made. It's imperative to understand that not every improvement can happen at once, and some actions depend on earlier work being completed. So definitely some prioritization happening there. For that same client that I just mentioned, the planning phase produced a roadmap organized again, across 7 fraud, waste, and abuse pillars. And across those 7 pillars, the HMA team identified 52 enhancement opportunities for the client. The roadmap gave the organization a structured view of what it wanted to strengthen without treating every opportunity as though it required or resulted in the same urgency, effort, or impact. After the planning phase comes implementation, and that's where recommendations have to become part of the day-to-day operations. This can include workflow redesign, updated policies and procedures, analytics support, provider oversight enhancement, and training planning. This is often the phase where many efforts tend to lose their momentum. And we just need to remember that a recommendation may be sound, but it still needs an owner, a sequence, practical tools, and enough detail for teams to act upon it. In the state engagement that I previously mentioned, the 52 enhancement opportunities were translated into 184 key actions, along with implementation tools, organizational recommendations, training recommendations, and monitoring and dashboard concepts. The point of this exercise was to give the client a practical structure for moving them from a organizational roadmap into actual program integrity action. Of course, all of this work only has value if the organization can then see whether progress is actually being made, and that is where monitoring comes in. Monitoring helps leaders understand whether the actions are being completed, whether the changes are taking hold, and where priorities may need to shift. Reporting should show more than just simple activity counts. It should also help explain progress, barriers, accountability, and whether the work is producing the result that the organization intends. And in that same prior engagement, again, we identified 116 success measures across the associated enhancement opportunities, giving leadership a more concrete way to evaluate implementation and progress over time, rather than solely just relying on whether a deliverable had simply been completed. We understand that organizations don't all enter the life cycle at the same point. Some need help understanding their risks, while others already know where their gaps are, and they need help developing a roadmap. Yet other organizations may be focused on implementation, monitoring, or a specific capability within the larger program. But collectively, the common thread is moving from identified risk and opportunities into practical improvements that can be implemented, measured, and most importantly, sustained over time. HMA can meet you where your organization is, whether that means a targeted phase, helping prioritize next steps, connecting work across the broader life cycle, or just the practice as a whole, what program integrity means for your organization. And so hopefully that can give you a sense of the capabilities your organization may want to think about as you reconsider program integrity and a practical way to move from findings into action. And so with that being said, I'll go ahead and hand it over to Elizabeth to continue the discussion.
Thank you. So as mentioned on the last slide, we have talked about aligning your PI functions and programs across the life cycle of your programs. We will now discuss an implementation of a statewide solution for program integrity enhancements that included EVV, electronic visit verification improvements, prepay analytics, and post-payment analytics. From a technical perspective and implementing change into your operational transformation, the life cycle, as previously discussed, includes looking at program integrity and fraud, waste, and abuse detection and intervention across the end-to-end claims and adjudication cycle. We're going to share about some of the product investments and enhancements that can be implemented at various points in the claims cycle. As part of this transformation, many states have a current state that includes both fee-for-service claims and managed care encounters. For this particular state, the current state included traditional MMIS edits that were hard-coded into a mainframe MMIS and traditional EDI edits through the electronic data interchange module. As part of the future state, this then was enhanced to a new EDI solution, setting up the front end of the claims adjudication cycle with more analytics and more capabilities for editing claims as the claim immediately comes in before it is processed through the mainframe. Additionally, in the current state, there was a heavy manual prepay review process that was primarily a paper-based process and using staff. This was transitioned through a prepayment review process that is automated and uses advanced analytics and generative AI for different models and implementation of claims edits. What we also traditionally see with our state clients as it relates to MMIS efforts, the legacy systems for updates can be very slow. However, the bad actors are acting very fast. Adding additional modernization efforts for prepayment review allowed the state to provide more timely claim edit updates from post-payment and prepayment perspectives. This also allowed for encounters to be reviewed during the post-payment process, and those insights from the post-payment processes were then informing the prepay analytics. And this was implemented last month and has proven to already provide value back to the particular state. Next slide, please. So as mentioned earlier, there were 3 core pillars of remediation as you're looking at fraud, waste, and abuse in program integrity efforts. The first step that we mentioned was mitigating errors before payment, which, as discussed, that could include a prepay analytics solution. The second was to monitor discrepancies between the claims and the data that is derived from the state systems. And the third is to use the data and provide additional provider education for remediation of errors and also as part of your overall PI strategy. We understand that all states are having issues with fraud and that bad actors are acting very quickly and schemes are becoming very complex. What we understand is that previous investments in program integrity efforts really had 3 major items. Post-pay detection allowed fraud to continue for months. It was very difficult to quickly respond to any changes and respond to new activity from bad actors. And the recruitment failure rates also were very high. The second issue with previous program integrity efforts is that all investigations have traditionally been manual, they've been slow, and they've been reactive. Applying prepayment analytics and other concepts that we've discussed today helps to turn into a more proactive approach to program integrity and fraud, waste, and abuse reduction. The third component is traditional prepay edits that may have been implemented previously fall short of program outcomes. They are primarily focused on billing errors instead of fraud and are often dependent on elongated claims engine enhancement processes, especially if your MMIS is a legacy MMIS or a mainframe MMIS system. Moving to an analytics platform for prepayment allows you to have more flexibility, and it's a modular approach to responding to fraud. Next slide. So within the state implementation, again, following the same concept of the life cycle of assessment, planning, implementation, and monitoring, what we show here is how we were able to take the state from the assessment phase based on a major fraud scheme within the state Medicaid program and move that into a full implementation. The implementation completed in July and allowed the state to have data-driven prepaid fraud detection and a modernized adjudication process that started with the EDI engine on the front end of the claim cycle and ended with post-payment analytics after the completion of the claims adjudication cycle and payment to the providers. This also included additional detection systems across the claims adjudication cycle, and the state has now moved into a monitoring phase where they're now using the insights from the engines to change and help enhance additional program outcomes, prepayment review processes, and develop additional claims edits that can be implemented in a couple of weeks now instead of a matter of months. Being able to go from an assessment into an implementation phase has allowed the state to also look back at business drivers and truly move into a transformed, modernized system. Additionally, for the state, health tech supported the non-emergency transportation use case, which aligns directly to the CMS and OIG priorities that were mentioned in earlier slides and was a key part to the planning process that was conducted as the prepay analytics were selected prior to implementation. I'll now pass it over to Patrick for the remainder of the presentation.
Thank you, Elizabeth, so much. I'm going to conclude our remarks before we open it up for Q&A, and my goal will be to synthesize the terrific information that you've heard from my colleagues here today. I would note at the outset, if you have not done so already, and I see several participants have done so, please put any questions that have occurred to you throughout the presentation today in the Q&A box, and we will work through those during the Q&A section as well as take new questions at that time. So with that, what I want to emphasize here is, in light of everything we've talked through today during the presentation, what type of support are we seeing organizations invest in to address the whole range of issues that we've talked about today. And really, we see the supports that organizations are investing in or needing to invest in really in two categories. The first, that again, this aligns overall to the life cycle framework that we've been talking about throughout the presentation. But the first category of support is really investment and advisory efforts. And so this is really about fundamentally establishing a broad organization-wide view of a given organization's program integrity risk. So from a leadership perspective, and when I reflect back to my own leadership as a state agency leader, both in Medicaid and in the commercial market, this really resonates with me. This fundamental scrutiny that we are seeing, that we've been alluding to throughout the presentation today, that public programs are facing across the board, both at the state and federal level. And what that requires from a leadership standpoint in terms of prioritization is strong governance, defensible controls, and again, that proactive approach to oversight so that you're not in the situation of taking a purely retrospective and being constantly behind the eight ball to address program integrity risk. And so the value proposition in engaging in assessment and advisory support is that you're able as an organization to deliver an objective assessment of program integrity, payment integrity, compliance, as well as leverage your capabilities to investigate across public programs, and then take that assessment and be able to prioritize what the actionable steps are that you actually need to take to strengthen your compliance and to actually reduce the program integrity risk that your organization is ultimately facing. And what you see illustrated on the graphic here on the slide is, again, the assessment and advisory type of support that we see organizations needing and that we're working with many organizations to put into place, stretches from governance, setting up the structure and the oversight of your program integrity and fraud, waste, and abuse efforts, all the way to actually integrating the outcomes of those assessments into downstream operations. And that can be in areas, as we're talking about, such as claims or compliance efforts or even vendor management. We can move to the next slide. And so then the other category of support that I think naturally flows and is complementary from the advisory work I was speaking about a moment ago is implementation support. So the context from a leadership standpoint here, of course, is that assessment solely, if you were to stop at the assessment phase, certainly progress can be made there, but it does not fully reduce or in a fundamental way mitigate your actual compliance risk related to program integrity and fraud, waste, and abuse. And so what we see organizations needing to do and doing when they're successful at it is they have to actually operationalize those improvements downstream to actually improve the governance, actually have new workflows in place, better technology systems, and more advanced analytics to actually see the full results and deliver on the full promise of achieving program greater gains in the program integrity space. And so the actual approach to implementation here, we see most organizations that have been successful at this taking a phased approach. So that's a practical applied model that really starts with going from the readiness phase and then all the way through fully realizing it in your operations. And the goal of this, as the last phrase on that part of the slide notes, is really to take a systematic approach here that makes this feasible to implement on an operational level so that you're minimizing operational disruption, but you are making systematic incremental change to put yourself as an organization in a much stronger place related to program integrity. We can move to the next slide. And so my final slide, just to really sort of sum up and synthesize everything that we've been discussing today. The opportunity here for organizations, and really we would argue the necessity, is really to drive faster readiness while helping protect financial and operational performance. And I hope a through line that you've seen in everything that my colleagues have presented today is really that a good program integrity approach is not distinct from just having really strong, high-performing operations. The same thing, the same measures and the same approach you would take to be a high-performing organization in any avenue, whether or not you're a state agency, a payer, or a provider. That's the best program integrity prevention that you can possibly do. And so in that way, it can help you achieve business outcomes that are not specifically program integrity related, but are supportive of those. And those are things, of course, like revenue performance, mitigating compliance risk, and just having and achieving operational excellence. And so more specific outcomes that you see in terms of how we think organizations are typically defining their measures of success for their program integrity efforts. First of all, reducing actual audit exposure. So again, when audits inevitably come, that you're in a strong position to answer those audits decisively and being able to prevail without a significant amount of material findings. Similarly, you're able to strengthen compliance, not just in one area, but some things that you can do on an enterprise effort can have, I'm sorry, on an enterprise level can have obviously outsized impacts across product types, across program types. And so that's something that taking action at the enterprise level and having an enterprise level strategy can pay dividends across the organization, even if you have a particular area that you are focusing in because you think there's particular risk there. Again, this focus on the top right-hand corner here on prevention, that certainly there's a role for retrospective analysis, and that will always be the case, but to the maximum extent possible, trying to detect FWA upstream and taking a proactive opportunity to prevent it from occurring in the first place. And then again, finally, trying to move as an organization while recognizing that every organization is at a different place in the life cycle that we've outlined and has different vulnerabilities and different challenges, but really working to accelerate taking a maturity model approach. And what that means is starting from wherever your organization is and figuring out what are the prioritized next step that you can take that can deliver the most outsized gains on the fastest timeline possible. So wherever you are on that spectrum, on that life cycle, you can take constructive steps to begin to lower your risk and start improving operations in order to achieve greater program integrity. So with that, I'll move to the final slide, and I'll turn it over to my colleague, Jen, to facilitate the Q&A. Jen, thanks so much.
Thank you all. A couple questions that have come through, and I think I want to start with, we've talked about, maybe I'll direct this to either Amber or Elizabeth or both. You talked about examples of states that you had worked with. My first question, I think, is what was the impact on, let's say, health insurers or providers of those changes that were made? I'm kind of like want to ask a series of questions about, there's the state that's going to come under scrutiny, and then there's the downstream effects on those who, participate in Medicaid programs. So if you have examples perhaps of, what were some of the big changes that came out of those audits that, would kind of bring that to life for those who participate in those Medicaid programs.
Sure, I'll go ahead and start. And really, the example that I was speaking to, this state program is really just getting a start on revamping their program integrity functions. So the result of our work right now was a roadmap and just giving them a bigger picture of where they are and where they need to go. And so the next step is putting those steps into place. And so it's really just the first step in a longer extended plan to just completely revamp that program. And so I think I'm seeing that they're going down a great path and excited for where they're going.
Great. Yeah, go ahead, Elizabeth.
Yep, and I think from the health tech perspective and the implementation that we just completed, one of the key components and key pillars of that implementation was to actually limit the impact on provider communities. And so there was a very diligent effort as we were planning the actual implementation to start with a lift and shift of the current edit structure that was already being utilized as prepayment review and transition that into an automated system. And so that really helped to limit any barriers to the fee-for-service providers.
And there's a question that I think was specific for you, although if anybody else, to you, Elizabeth, if anybody else wants to jump in. The question was about, can you list preferred or existing tech products that have an analytics platform for prepay? Maybe you could talk a little bit more about that.
Sure. Health Tech Solutions, we actually offer a prepay solution. We also offer a new EDI product that has been on market and implemented in 2 states. And so both of those are being used as the prepayment function in conjunction with the system integration platform that we're responsible for developing and implementing. In addition to the technology stack that we have at Health Tech as part of our product stack, we also have worked closely with Olivia Analytics in the state that was highlighted today. And Olivia Analytics was the product set that provided the actual prepay module and post-payment module for that state in conjunction with the health tech system integration and EDI platforms.
Thank you. There was a question, I think Amber gave it an initial answer, but I might ask it, and Jen B, it's good, there's always two Jens, Jen B, if you have an answer. But the question was, for states being targeted, what types of programs are most likely to be under increased scrutiny? I think you touched on this a little bit in one of your slides, but maybe talk a little bit more about, what's kind of rising its head above the line.
Yes, so definitely NEMT, ABA therapy is also another one, and then just general behavioral health services as well. All of those are high priority items. I would also say that there are a few items though that have always kind of been high priority items for, law enforcement and CMS, other payers. I'll mention those too. So Modifier 25 is something that's highly scrutinized. And so that is something that's always on the radar of law enforcement, of CMS, just constantly. And
Can you
then
talk more
also,
about what that is? Sorry,
yeah,
just to be
so
clear.
Modifier 25 is an evaluation and management modifier. And essentially, you're allowed to state with that modifier that it is a separate and distinct service on the same day. And so I feel like over the years, because that hasn't, there have been a lot of errors associated and payments associated with that code, that it is just now it's always looked at lot, and especially, and also evaluation and management services. So specifically those that are office visits, so like a 99204, 99205, all of those are highly scrutinized. And then 99214 is actually the highest bill code to Medicare. And so that one's just always, because of the volume, there's a lot of overpayment dollars associated with that CPT code.
And what is that code? You're like amazing that you just rattle these off your head. Hopefully people understand how much you understand this. But what is that code associated with?
Yeah, so 99214 is an evaluation and management code, and it's for an outpatient office visit with an established patient. So there's medical decision making associated with that code, or you can code it based on the total minutes of time spent on that encounter date. So yeah, just um, lots of audits related to that. Over the years, evaluation and management services.
And how are if any of you have thoughts on this, how are we reconciling some of the items that you mentioned, behavioral health, ABA? I mean, these are areas where we know that there's huge demand and not enough providers, right? So, and I, the CMS guidance pointed out that, for ABA, I think it was, the percentage increase is far and above the percentage increase of incidents. But at the same time, we're trying to solve for helping people in an area where we don't have enough providers. So, what lessons are we learning, or what are, I don't know, I guess the question is, what guidance have we been able to offer where, you're trying to be creative to solve a problem, but obviously there's fraud associated with that as well. So how are we striking a balance there? It's a vague question, but I
Yeah,
think it's
I'll take
good.
I'll give an answer, and I think Christine came off mute too. So I think, one thing that I'm personally seeing is just I'm being asked to complete a ton of provider education. So not only, really taking the time to I'm not only teaching them about the use of the code and documentation, but also just discussing the risk, because I think a lot of times when, you tell someone that they're going to have to document more or document differently, um, and you say, hey, this is best practice, I think sometimes that can feel like administrative burden. So when I educate, I spend a lot of time focused on not just doing the right thing, but when doing the wrong thing, what that can look like. So using actual real life examples and clinical vignettes to explain, how that can impact, your organization's financial health.
And then just to piggyback on that, Jen, you hit on the education piece is so critical, but then also really making sure that you're scrutinizing your policies and procedures so that way they're accurately reflecting the things that you're doing. And especially in some of the high risk areas that have been mentioned, a lot of times grant money is being, used to augment those programs or to provide additional training programs, et cetera, to increase the population of the providers available to do those services. Those programs are going to get more and more scrutiny because they want to know, and federally speaking, where have those dollars been spent? And so it's making sure that you've got a really, really strong paper trail on where that money is going and how those dollars are being spent to move outcomes on, whether it's member health outcomes or just an increase in providers. But it's really making sure that it's not only the clinical documentation needed for the claim, but it's also making sure your enterprise documentation syncs up with what you're doing.
And Jen, really quick.
Defensible strategy.
Yeah, just to build off of that, if you don't mind, Jen, something I think that occurs to me that Christine and Jen both make a really strong point that really comes into is that for states, to the point of your question, Jen, those policy goals that you outlined of improving access and having greater access to high quality services, particularly in areas where there have been challenges, right, in the past, that policy imperative for states is not going to change. However, I think a real opportunity for payers and providers who are obviously remain the key partners to states in accomplishing those goals, to Jen and Christine's points, if they can demonstrate not only to mitigate compliance risk, but the fact that states are going to want to have confidence that as they continue to pursue those access goals, that their partners and that their vendors in payers and providers are taking these steps so that it doesn't open up states, payer, or the provider to federal or other types of compliance risk. So I think the value proposition is not just mitigating direct organizational risk for payers and providers, but it's also there's an opportunity here to position yourselves with your state partners as being their go-to resources that they can feel confident as they try to implement access initiatives through you and with you, that you have the tightest program integrity processes and policies possible. So it gives them a greater confidence in being able to pursue those goals, which are no less relevant, even in a heightened program integrity environment.
That's good clarification. Thank you. There's a big question. I'm going to read it, and you can all think about how you might answer it. So the question is, what differences, and by differences, this could be policy, planning, operations, organizational investigation, et cetera. So what differences do you see between PIUs, SIUs, state PI office, and MFCUs? And then how should any of them be cooperating with state criminal justice or OIG units, police, law enforcement, et cetera? So maybe some thoughts on that interplay between those entities.
I can share just an insight from our recent implementation, but within that state, the Mofuku actually will be accessing particular components of the analytics system. And that state has also really put a diligent effort into coordinating with their local law enforcement, coordinating with their Attorney General's office, the Mofuku there, and other areas of that. So it's a very collaborative effort. And I think that particular state would also be one to say that that was a key piece of redefining their program integrity and fraud, waste, and abuse efforts. And so that was taken into consideration in our planning phase as well, as we were mapping out the roadmap for their product set, is how any of that collaboration may come into play. And from a technology perspective, being able to set up different roles so that that can be achieved from an actual analytics perspective.
I also have something to add as well. So I used to be a fraud investigator for a ZPIC, which is now a UPIC. And I have, going through that process and working somewhere like that, we actually routinely would work with different agencies on investigations. I specifically remember working with FBI, the OIG, and the DEA on, billing schemes and things like that. But literally sitting in a room and looking at claims at that level with my OIG case agent, or like burning them at the time, burning them to a CD, and then us meeting later for updates and next steps on the investigative process. So there's definitely a lot of collaboration, and but there also is, as far as what is important to them and what they're going to review. If you go and look, you will see that there are and will be nuances in that, but the overall goal, is to always protect, the trust funds, whether it's Medicare or Medicaid. That's the goal.
Another question, what Medicaid behavioral health services are most targeted, and how? So double click here on the behavioral health comment from before. How are above board BH providers experiencing the scrutiny when often their billing systems, payer relationships have been structurally different and more complex? So how do we kind of protect our BH providers that are doing the right thing, and what in particular is being targeted within BH right now?
So, um, specific services right now, I know that a lot of it is ABA services. So, and unfortunately, I've worked with multiple states, and even a provider that is low volume can have investigations opened, or, have prepayment review on. Um, there were times I know personally where I opened investigations just because there was nothing else to do. So you conduct data analysis, and then, you know, that's reason enough to open an investigation at that level. But I can say, um, for sure right now, ABA, so applied behavior analysis, that is just at the forefront um, of everybody's mind, because it has a lot of reimbursement associated with it. And so I feel like, and the documentation is not always done well, and it has been a struggle throughout this industry with documentation. Although I have seen, some providers um, improve.
Um, Question about so you talked about states, obviously some states are targeted, some states have not been targeted, but I think you've all made the point about really wanting to get ahead and to be more proactive. So maybe talk a little bit, and Patrick, maybe I'd throw it to you first. For health plans and for providers, right? They're like, what does proactive look like right now? Maybe you're not in a state that's been targeted. So maybe you think, well, I got plenty of other stuff going on. I'll worry about this later. But what does it really look like to be proactive right now? What are some specific things that you find that those who are being proactive are focusing on?
Sure. And again, welcome my colleagues here too, Jen. But I think to me, the foundational point is that I think no matter what organization you are in what state, and I would argue that yes, there, as we alluded to, there are states that are facing additional scrutiny or having the scrutiny first. But I think it is absolutely certain, or very, very close, absolutely certain that some degree of increased scrutiny is coming across the board. So it's really just a question of timing. So I don't think any organization across the country, in whether or not you're in the provider space, the payer space, or upstream in any given state, can reasonably expect that there's not going to be a heightened level of scrutiny. That just simply, I think, is not a feasible way to approach it. So to your question, more specifically, then, okay, so then what does it look like to be proactive if you're not under immediate scrutiny that seems heightened? I think it's at a bare minimum, I would argue that that every organization, and this could be to different degrees, absolutely at a bare minimum wants to be doing that baseline assessment phase to be able to understand what their specific organizational risk is and have a roadmap, has had to be fully implemented, that targets those specific areas. And obviously that can be prioritized, right? That might be smaller based on the scale of organization or their level of risk or complexity, or it can be larger and more comprehensive. And each organization should right size that. But I don't think it is. I would not advise any organization to take no action. I think you absolutely have to have an understanding of what your level of risk is, and then you can take prudent steps to decide what you act on now and what can be deferred from a prioritization standpoint. But welcome, Amber, if you have additional thoughts here, really welcome your thoughts too.
Yes, and I'm going to apologize. It started storming horribly at my house in the middle of this presentation, so I've been trying to stay on mute. But I just wanted to echo what you said, Patrick. That underlying assessment would be the key first step, and particularly for like a state Medicaid agency, you may want to look at letters that some of those states that have been targeted have received, just to see to prioritize that assessment, to see if there are any issues brought up in those particular states that CMS or OIG has pointed to that you may be at particular risk for as well.
And then, maybe one last question, which is maybe a softball setup, but I'm going to ask it anyway. I mean, I think when people think about this, it's very kind of punitive and fraud and waste and all of those kind of being very negative repercussions. But I think, there is a different way to look at this, which is really about efficiency and outcomes. And, I think at the end of the day, everybody probably understands that there's some level of fraud. One of you had that on your slide, but everybody also understands that, we want to be stretching our dollars as far as we can. So, how would you frame really the upside of this in terms of taking those proactive steps, right? It's not just about wrongdoing, although you want to figure out your exposure, but it's also, right, how can we be connecting more resources to the right places to do the right thing to improve the outcomes for the people who need it. So I don't know if that's a question as much as a statement, but I mean, if anybody has anything to state on that, I think we should just maybe end that with that point, because I think it's easy for it to get caught up in the negativity and the who's on the list and whatnot. But there's kind of a lot of good reasons, I think, to do this work.
And I'm glad you brought that up, Jen, because moving away from the punitive nature of it and getting ahead of it, really, feedback is a gift. So every time you've had an external quality review audit, or any time you've had these program audits, beyond just checking the box to make sure you've, done the risk mitigation and you've done your remediation plans, how have you organizationally or institutionally implemented those changes so that way you're doing the continuous process improvement? So that way you say, okay, we did this. And then is there learnings that can be gauged elsewhere throughout? We talked about, early on, the interconnectivity and the connectedness needed. So, when you identify something, really doing the diligence to move across all your departments, it's almost scenario planning of, okay, if we were to find this again, how would we respond? And so it's really establishing that institutional rigor. So then that way it's the, like you're talking about, it's spinning it on its head. So it's moving away from the punitive into the, how can we do this, better, smarter, faster? So then that way those dollars can be invested and really show the value of the programs in which we're all administering.
Yeah, and Jen, just to kind of build on that, the way I've always thought about this, and this I think holds true for any stakeholder, for any of us that are involved in serving public programs, whether or not that's you're actually at the state and doing that work, or you're a payer or provider or other organization involved. But collectively here, everyone has an interest and is committed to ensuring not only that obviously that we do everything possible to prevent and remediate fraud, but to your point, many of the steps that you would want to take to lower risk from a risk-based lens are simply the things that you want to be doing to serve beneficiaries as strongly and as fully and as efficiently as possible. So I think if you reframe it, and I think that's not just a sort of communications reframing, I think that is substantively true, that to achieve operational excellence and serve people and get the best outcomes, many of those steps will overlap almost exactly with the steps you would want to take to also lower program integrity risk. And so I think it's best thought of as an integrated part of your overall program to achieve operational excellence and serve people as well as possible, no matter what organization or sector you're a part of.
Well, I think that's a good place to land it. I will make two plugs here at the end. One is that well, maybe I'll make three plugs. One is that the full series, again, just as a reminder, the full series is online. If you go to the website there, you will also be able to see information about our HMA conference coming up in October, where we're going to have sessions on these topics, including a specific session on ABA with some great speakers. So something to look for there. And I will also just plug that Jen Bridgeforth, we did a podcast last year, and she educated me and others on really there's a big difference between we talk about waste, we talk about fraud and abuse in terms of intentionality, in terms of, what you need to do. But I think Patrick's point is, if you're fixing one, you're really fixing it all. And it's all really an important opportunity. So appreciate everybody's time. Appreciate the great insights of the folks on this panel. If there's anything that any of them can do to be helpful to you, please let us know and we'll get you connected. And we appreciate your time. Thanks, everybody.